Morning, ma'am. Good morning to all. So, myself, Mrs. Amudhavalli, Professor History of Narayana College of Nursing. So, today my topic is about nephritis. So, what are some infections and inflammations of the kidney due to many reasons? So, we can say what are the risk factors, like what about the clinical manifestation of nursing management. So, those things. So, nephritis, it is coming from the Greek, it comes from the Greek word that is nephro, meaning of the kidney, and itis, it means of inflammation. So nephritis, it is an infections and inflammations of the kidney. So it can cause death if it is not treated in the initial stage. So it often strikes during childhood as well as in the adolescence. So types of nephritis, it is acute nephritis and chronic nephritis. So acute nephritis, it is mainly caused by the hypersensitivity, that is allergic to certain drugs like analgesic as well as the aspirin and cyclosporin used for the treatment of certain autoimmune disorder, and anti-cancerous drugs and medications to treat depression such as lithium. So those are all the drugs which causes the nephritis. So coming to the chronic nephritis, it can similarly but due to the very large number of causes, mainly due to hypertension, then polycystic kidney disease, autoimmunity, obstruction of the urinary tract, high blood high blood calcium deposition in the kidney as well as the uric acid deposition in the kidney, so which it leads to the cadmium intoxications. So acute nephritis, it is mainly due to the hypersensitivity to the certain drugs as well as the certain intake of antidepressant drugs and the intake of treatment of autoimmune disorder. So whereas the chronic nephritis, it is mainly due to hypertension, the polykidney disease, any obstruction of the urinary tract, and the high intake of calcium deposition in the kidney as well as the high uric acid deposition in the kidney, so which it leads to cadmium intoxication. So this is how the normal kidney and the polycystic kidney. So these are all the depositions of the uric acid and the calcium deposition in the kidney, where it affects the, finally it leads to the infections and inflammations of the kidney. So subtypes, so glomerulonephritis, or does infection and inflammations of the glomeruli. So interstitial nephritis is nothing, it is about the interstitial nephritis. It is an inflammation of the spaces between renal tubules. Then pyelonephritis, it is due to the UTI, so where it reaches phylum of the kidney. So pyelonephritis, it mainly due to the prolonged urinary tract infection, as well as the lupus nephritis. It is an inflammation of the kidney where it is caused by the lupus erythematous, so which is called as the certain disease of the immune system. So here, what is the parts of the nephron? So here we can see. So that is the glomerular filtration rate. So where the glomerular filtration affects. So due to infections, then damage to the capillaries. So it causes the retention of the nitrogenous waste products in the blood. So it leads to the kidney failure. That is the infections and inflammations, nephritis. So here we can see that is the renal artery as well as the renal vein, where it acts on exit and entry of the blood into the kidney. So here we have the ascending tubules as well as the descending tubules, where it filters the blood and makes the excretion, that is makes the urine out. So this is the glomerular filtration. So what is the main cause of nephritis? It may be caused by the bacterial infections of the kidney, where it is exposure to more toxin. So from the abnormal immune reactions, it can occur in two ways. That is, an antibody can either attack the kidney itself or the substance that stimulates the immune reaction attached to the kidney cells. Whereas where we can say it as where the antigen antibody reaction that is triggers, it can affect the kidney, it can affect our immune reaction also. An antigen antibody can combine somewhere else in the body, so forming an immune complex then attached into the cells of the kidney. So for all the risk factors, those who are having the weak immune system, they prolong the throat infections, which is caused by the streptococcus bacteria. So the infection does not occur in the kidney, but it does in the different parts, such as the in our skin, in our throat. Streptococcus infections causes the tiny blood vessels infiltrating units of the kidney, and it becomes inflamed. So this infections is mainly affects the blood vessels of the glomeruli. So where it causes the inflammations of the kidney. So we are nowadays we are practicing a wrong dietary habits, then excessive intake of alcohol consumption, then frequent use of painkillers. So these are all our lifestyle practices we are practicing in our day-to-day life. So these are all the risk factors which can cause us the nephritis. So due to the etiological factors, so it causes injury to the glomerulus. So automatically the glomerulus becomes inflamed. So due to the retention of the hydrogenous waste, so it leads to mild proteinuria as well as the mild hematuria. So it causes accumulation of cell blockage and finally leads to decreased glomerular filtration rate, where it completely affects the filtration rate. So the nitrogenous products, nitrogenous waste that is remains in the blood wherever it is. So it causes the increased blood pressure, oliguria, edema, as well as the mild azotemia. So azotemia is nothing but that is the abnormally high levels of nitrogenous compound such as urea, creatinine, and various body waste products and other nitrogen high components in the blood. So oliguria, it is nothing but as a decreased urinary output, so which is less than 1 ml per kg per hour in infants, so less than 0.5 ml per kg per hour in children, and less than 400 ml or 500 ml per 24 hours in adults. This equals 17 to 21 ml per hour. So that is oliguria. So which causes, sometimes it leads to dribbling of urine also. So main clinical manifestations we can say that is the swelling of the tissues. Definitely tissue becomes inflamed, then tiredness, then cloudy urine, uremic, pus and urine, weight gain, mouth ulcers, fever and rashes. So these are all some of the clinical manifestations we can see in the nephritis. So coming to the diagnostic evaluation, so we need the thorough history collections and physical examination, kidney function test, then renal biopsy. So imaging studies such as the ultrasound or X-rays, which is used to determine the blockage as well as the inflammations. So kidney functions and kidney biopsy to rule out any infections as well as the any tumors or polyps. In order to determine, we can perform the renal biopsy as well as the kidney function test in order to rule out the glomerular filtration. The physical examination, how frequently that is the painers, what is the characteristics, what is the intensity, duration on site. So in history taking, we can collect all those factors history taking and in physical examinations. So coming to the management, although the medical management is symptomatic, so which include the treat of symptoms where depends upon the following things. So we can administer either corticosteroids in alternatives of immunosuppressive medication are often effective in reducing these symptoms. So in case of pyelonephritis, a 6 months course of antibiotics may be necessary to rid out the infections. So here we can use the antibiotics such as amoxicillin, trimethoprim, as well as the sulfamethoxazole. So these are all some of the antibiotics we can use in case of chronic pyelonephritis. Yes. So hypertension can be managed with hypertensive drugs such as the calcium channel blocking agents. Then due to dietary patterns, then due to our lifestyle modifications also, that is the hypertensions can be managed. So other management, so dialysis. Dialysis is the final stage of end-stage renal failure. So it can be necessary to control the symptoms of acute as well as the chronic renal failure. Orders of the end-stage management, other management is we can go for the surgical management, that is the kidney transplantation. So may be recommended to treat kidney failure resulting from lupus erythematosus, lupus nephritis. It is not due to the systemic lupus erythematosus. So for that condition, you can do the kidney transplantation. So kidney transplant is a surgical procedure to place a healthy kidney from a live or deceased donor into a person whose kidney no longer functions properly. Here about the renal transplantation. Does a kidney, as we know, are two bean-shaped organs located on either side of our spine, just below the rib cage. So it is of about the size of our fist. So their main function is to filter and remove the excessive nitrogenous waste products and fluids from the blood by producing urine. So by three mechanisms, that is by osmosis, filtration, and by excretions. So it producing that is the formation of urine occurs. So when the kidney loses this filtering ability due to the whatever causes we have seen, due to the aging factors, due to aging and all, the degeneration of cell is very common among all the old age. So due to that reasons, due to prolonged infections, then due to poor dietary habits, then due to poor lifestyle modifications, so everything can lose the filtering ability. So it causes the harmful levels of fluid as well as the waste accumulation in the blood. So which causes the waste gets accumulated in our blood. So it leads to increased blood pressure and it leads to end-stage renal disease, which is known as the end-stage kidney disease. So it can occur when the kidney have lost about 90% of the ability to function. So there is more than those, so we can do only the kidney transplantation one. So the common cause of end-stage renal disease, it includes diabetes mellitus, chronic and uncontrolled high blood pressure, then chronic glomerulonephritis. So this chronic glomerulonephritis and inflammation and eventually scarring of the tiny blood vessels of the kidney. So it leads to damage of the glomeruli and its capillaries. Then polykidney disease. So these are all some of the causes of end-stage renal failures. So here that is the types of renal failures. So it includes, so people with end-stage renal failures, so they are need to remove the waste products from the bloodstream via machine as called as the dialysis or the kidney transplant, or they need only the kidney transplantation to stay alive. So the types of renal transplantation. First one is the deceased donor kidney transplantation. So here the deceased donor kidney transplant is when a kidney from someone who has recently died is removed with the consent of his family or from a donor card, and it is placed in a recipient whose kidneys have failed and have no longer function properly, and it is in need of kidney transplantation. And in case of the donated kidney is either stored on a ice or connected to a machine that provides oxygen and nutrients until the kidney is transplanted into the recipient. The donor and the recipient are often in the same geographical region, so it can minimize the transportations as well as the transplantation center to minimize the time, and the kidney is outside of human body. So only one undonated kidney is needed to sustain our body needs. For this reason, a living person can donate a kidney, on a living donor kidney transplantation as an alternative deceased donor kidney transplant. So second type was a living donor kidney transplant. So here a living donor kidney transplant is the removal of the kidney from the living donor and placed in a recipient whose kidney function is not working properly. About 1/3 of all the kidney transplant performed in the United States are living donors kidney transplant only. So the 2/3 involve only from the deceased donor. So living donor kidney transplant usually involves a donated kidney from someone knows, such as the family members. They may be the family members, friends, or the co-workers. So genetically related to the family members and most likely to be the compatible living donors who has the same blood groups. The living donor kidney may be someone patient do not know, or a directed living kidney donors. So both patient and living kidney donor will be evaluated to determine if the donor's organ is good match for him. So in general, patients with blood tissue types need to be compatible with those type of donors. So here the nursing management, it is based on the complete history of the client, as well as it includes inspection, palpation, and auscultation and percussions. So by methods of physical examinations, we can determine so what type of pain that is the patient. First one is the flank pain. So there you have to note it down the intensity characteristics like in durations and episodes, everything you can note it down. So the first symptom is below the rib cage. So back pain will be very severe and it is radiating into the like bladder also. They'll be having difficulty in passing the urine, sometimes dribbling of urine. So those are all the signs and symptoms you can note it down. So the main problem is improper nitrogenous waste products, that is which is not removed from the blood due to infections and inflammations of the glomeruli, capillaries, as well as the blood vessels of the kidney. So it causes the infections and inflammations of the kidney. So finally, the surgical management includes only we can go along with the kidney transplantation as well as the like dialysis. So dialysis, that is a process of removing the nitrogenous waste products from the blood. So we can main thing is we can keep hydrated ourselves. So for that we have to change our lifestyle modifications as well as our behavioral patterns as well as our food habits. So you have to take the healthy foods which can keep us healthy. So you have to keep hydrated yourself. For that you have to consume at least 3 liters of water per day, so which can balance our hydration as well as the balanced our metabolic rate also. So these are all some of the nursing management we can stay with the healthy kidney. Thank you.